Greetings and welcome. My name is Doriel Larrier, and I am the host of the Lott Carey Wise Digital Couch. Welcome to our January session, and we are so excited to have you here. As part of the protocol that we know to call, first let us tell you who is who in the building, in the digital building, if you will. On behalf of our Executive Secretary Treasurer, who is Reverend Emmett L. Dunn, our President, Dr. Jesse Williams, our first Vice President, Dr. James Victor, and our second Vice President, Dr. Robert Scott. Of the Women in Service Everywhere, we have Reverend Dr. Brenda McBurrow, who is our president. We have Sister Lynette Richardson, who is our first Vice President, and Minister Brenda Troy, who is our second Vice President. Our team leader for Men on Missions is Brother Charles Monterio, and the youth department leader is Reverend Brittany Mingo. Let us welcome everyone into the room this evening. On tonight, we are beginning our next series of celebrating 125 years of service that the women have had as a part of Lott Carey. So welcome to our new series. During this year, we will be taking a look at a variety of women who are in the many places and spaces here, not in the Lott Carey seats locally, but also in the Lott Carey seats globally. And so during this year, during 2025, we will meet, we will greet, we will engage, we will discuss how their professional work, how their personal service impacts the process and the progress that we try to make, not just here locally, but also across the world. And so this evening, let me give you a little bit of housekeeping. Our housekeeping includes, well, what's happening with Lott Carey. So I know that you know that the first of every month, so that was yesterday on January 1st, we actually have our monthly prayer call. It is at 6:30 in the morning. And so if you stay connected to Lott Carey, either Lott Carey TV or Lott Carey Wise Salt on Facebook, you will see the notifications for our 6:30 a.m. prayer call. We always have a wonderful word. We have some amazing women and men who get together in order to celebrate and to praise God. And we also have a moment, of course, of sharing the good news that's happening around Lott Carey. In addition, what's coming up is our 31 days of prayer. So in March, this is January, but we have to get ready because at the end of February, we'll have our 31 days of prayer pre-service. And then every single day for the month of March, we will engage in prayer about a country that we participate in, that we service, that we do work with and work for. And we're going to be praying for that country and the needs of that country from the eyes and the ears of women in that country. Then we will have in March our spring session, and that will be coming up in Ohio. So please get ready and stay tuned for that. As well as in May, we will have our Jumping for Justice anti-human trafficking service, and that will be happening in New Jersey. So please stay tuned. How are you going to stay tuned? 2 ways you can stay tuned. Well, 3 ways. LottCarey.org, of course, which is our website. Also, follow us on YouTube at LottCareyTV.org. If you want to do the email way, it is LottCareyWise1 at gmail.com. And if you are on the Facebook, in Facebook land, come and join us at Lott Carey Wise Salt on Facebook. We look forward to having you, and let's get into tonight's conversation. So tonight we're going to be sitting with one of our dear sisters who you probably have seen in the Lott Carey land, and that is Dr. Sharmaine McCoy. So let's welcome her. Good evening.
Hello. Hi.
Good evening. Good evening. It's so good to have you here.
I'm excited.
We are very excited. So once again, I just wanted to share with people, and those of you who know, I'm looking forward to have you drop in the comments. Please shout out who you are, where you're watching us from. Shout out your church, shout out your pastor, so that we can let people know who is actually watching. And of course, please share it with someone that you know who should hear this information. So tonight we're going to be engaging again with one of our Lott Carey women, because again, this is not only 125 years of celebrating the work that women do, but also taking a look at how the women, not just here in the States or here in our cities and counties and towns, also take that work that they do professionally and personally as ministry in their church, but also take that work across the seas. So we're going to start not just getting our total life right, but specifically our physical health right, and how that impacts how we look at folks across the seas and across town. That's why we have Dr. Sharmaine M. McCoy. Welcome, Dr. McCoy.
Thank you for having me. I'm excited to be the first guest this year.
Excellent. You are the perfect guest this year, the perfect guest for the first day. So I'm actually going to let you introduce yourself, because what you do professionally and personally impacts how we are actually going to be looking at what we do, again, across the state and across the globe. And for those of you who did not know, because 2025 is looking great, we're actually going to have a little bit of a teach-in tonight. So get ready, get your pens, get your mug. Let's learn as well.
Awesome. So first, let me just give a shout out to my church. I am a member of Mount Olive Baptist Church in Centreville, Virginia. My pastor is Jonathon TG Wilkins. We just had transition of leadership with our pastor. Previously, we had Reverend Dr. Eugene Johnson for 32 plus years. So it's been a great season for our transition. Within my church organization, I am the president of our health and wellness ministry. So I am able to fuse what I do professionally with missionary work, outreach in our church, in our community, which I absolutely love. Then when we think about whys and how I got involved, Reverend Dr. Brenda McBurrow is my big sister. Also a member of Mount Olive Baptist Church. So she welcomed me with wide open arms. Personally, I have to say we connected in 2016 when I lost my mother. Brenda reached out to me, and it was the sweetest thing, because she was like, even if you don't have anything to say, she was like, I just want to call you. I want to check on you every day. And I think that was so impactful to me. We both have the gift of gab, so the conversations lasted. And because of that relationship, even when things are going on with me now, it's like she has this sense where, like, I get a text message from her and she's like, hey, sis, can you talk? And it's like the right, perfect moment when I need it. Took my first missions trip with her and our church members. It was about 18 of us. We went to Ghana in 2017. We were there for 2 weeks. It was such a beautiful experience. And then I got bitten by the Lott Carey bug in 2018. So my first Lott Carey experience was when it was in Atlanta in 2018. And can I tell you, it blew my mind. The sessions, the people, and now honestly, like, I look forward to Lott Carey so much, to Lott Carey family members, meeting new people. It's just such a great experience. Exactly. It's such a great experience. Yeah, it blows my mind. Then when we think about women in service everywhere, such a great subsect of Lott Carey and its intentionality, right? Like, it is really inclusive, where every woman belongs, and it's like they just want to utilize your gifts and your talents. A lot of times I am voluntold, so so sometimes I find new gifts and talents, but I really appreciate it. So our outgoing president, Reverend Dr. Angelita Clifton, just giving me the opportunity to do a giving circle where we provided supplies to Liberia. That was really phenomenal. So my Lott Carey experience so far has been nothing but the best. And I'm able to utilize missionary skills and stuff that I learned at the conference and infuse it into the things that we do locally here. So my job. And then to even explain.
Wait. So I have to like put a pin just for a second. First of all, I need to give you a shout out because there are a number of people who are saying hello. So you need to like say hi to these people. 1 second. Let me pause this for a second.
Okay.
Take a look at who is sending you love.
Aww. So Misha from my church, she's in my health ministry. Brother Dave Curtis, he's been instrumental. We've done a walk run challenge. He was the brains behind that. Dr. Brenda, Reverend McBee, Yolanda, one of my mom's besties. Roland, who is a lifelong Black Carey, Mount Olive person. And then one of my girlfriends from Philly. Aw.
Yay. Excellent. I just needed to make sure that you see the people who are sending you all sorts of love. Okay. Thank you, Brother Roland. Praise the Lord for Dr. McCoy. Fabulous. Okay. Wait. Now people are showing up. Hold on. Okay. Love it.
Be in South Carolina.
Come on, South Carolina. Come through. Okay. I love it. So now I want to get back to all of these letters behind your name. So of course, when I said, okay, I say this to everybody. So how should I regard you? How should I address you? And she's like, well, it's kind of complicated. So help me out. Help these sisters out and the brothers who love us as well.
So I think the easiest thing, and one of my college friends, he actually like helped me adapt this term when I was telling him I was going back to get my doctorate in nursing. So he was like, so you're like a doctor nurse? And I was like, exactly. So not a physician. I am a nurse who has a doctorate. And then my pathway, my career has spanned. So I got my undergraduate degree from Hampton University in 2000. So in August, I will celebrate 25 years of being a registered nurse. I know.
HU. Just saying.
Yeah, so I definitely bleed blue. And then I got my master's degree from Virginia Commonwealth University, becoming a nurse practitioner. So in June, I'll celebrate 19 years of being a nurse practitioner. And then I went on to get my doctorate. And with the doctorate in nursing, so it's different from a PhD, which is more research focused. The doctorate in nursing is more of a clinical degree where we look at things that go on in practice and how can we improve those things. And then we do work in conjunction with our PhD nurse colleagues. So for me, currently, I work in women's cardiovascular health, which is a new subspecialty in cardiology. And I actually love it because I have the opportunity to see women in their reproductive years. Most of them are pregnant or going through a pregnancy where now they've either been diagnosed with high blood pressure, they had a prior pregnancy where they had preeclampsia, and preeclampsia is a pregnancy complication where you have high blood pressure. So usually blood pressure is higher than 130/80. And then you also start to spill protein in your urine once you're about 20 weeks pregnant. And then this can even extend into after you deliver. So it's a pretty long span of time. So the good thing is if I see the women during their pregnancy, then I continue to see them after they deliver their baby. And we're considering this the fourth trimester, which is lasting up to 12 months. So we're monitoring them that long, which we're finding now that knowing a woman's reproductive health, how she delivered, did she have any adverse outcomes, such as preeclampsia, did she have gestational diabetes while she was pregnant, does affect the cardiovascular health later in life.
There we go. Okay, so two things, and then we'll get into, so some people are like, why is this important? Hold on, it's going to get better. Watch. So first of all, I have a shout out on, it's not here, but it is from Dr. Angelita Clifton. So she says much love to her.
Aww.
And then we have Small Sanders.
Mm-hmm.
Such a blessing and skilled practitioner devoted to our community. So this is the key. This is the key. So as Dr. Sharmaine, Dr. McCoy, I'll say Dr. McCoy because that is your
I like Dr. Sharmaine.
Okay, Dr. Sharmaine. As Dr. Sharmaine and I were doing sort of like our pre-conversation, and She was highly recommended by Dr. Brenda McBurrow. So thank you very much for agreeing to be our first guest. I really wanted for us to elevate this conversation on the digital couch, not just that people would sit and sort of hear about sort of tough conversations and tough things that have to do with people over there that sometimes we feel we're not connected with. I wanted to make sure that the work that we did during this year involved a couple of things. What does your personal mission, and if it connects with your professional work, and how is it, because like you said, you were voluntold and you are being voluntold, how can we take those gifts and then utilize them as we do the work, as we do the global mission work? So when you said, sure, I'll come on, I'm like, oh, excellent. And then I said, this is wonderful because we now have a new lens. So the work that you do with women during gestational periods and sort of the prior, the during, and then the post, how is that now impacting the work that you do in your community locally? And then how do we, because I know we've already utilized it, but how are you now able to take that lens and use it in the mission work that we do globally? So now, before you answer, some people already know because you've been on mission trips. Drop in comments or add questions, and then we're actually going to have like a little PowerPoint presentation here because that's how we do. Drop in questions about if you've gone on a mission trip, or even if you've done local missions here, what things have you, our viewers, have noticed or seen or had questions about? How can we really serve, add on, come alongside people during the birthing process and dealing with maternal health? So as questions are coming in, and I will pop them up, that's what I want you to now talk about. Like in your current work, how do you use that as a lens when you've gone overseas, or in the work that you will do as you do the mission work?
So I think is the multifaceted answer to that. When we think about high blood pressure in general, it affects African Americans, Blacks, Africans significantly. Hypertension is one of those things where there aren't a lot of symptoms. So sometimes people can walk around for days, months, years, and not even know that they have high blood pressure. So I think when we think about what do we do locally, as well as what do we do internationally, it starts with the education piece, right? So just the education around hypertension, we know that it's starting to happen just because of the American lifestyle and diet being sedentary a lot earlier, where traditionally we used to think, oh, this was a disease people would get in their 30s and 40s. Now we're seeing teenagers, early 20s. So one of the most important things I think we can do is always knowing your numbers. So, I always hear, even when I do health fairs in the community, when you try to get people to come over to the table to get screened, they're like, oh, I'm good. But I'm like, how do you know you're good, right? Like we can make that assumption and say that we're good, but until we actually check the blood pressure on a regular basis. And then I feel like if you only go to the doctor once a year for an annual checkup, that's still one snippet in time where it doesn't really show long-term what your blood pressure is. So is that one of those ones where you go and it's low that day? But then, if you were monitoring it even at home, you would know whether or not it was an issue and something that needed to be addressed. So I think education, I will always say is like the foundation for where we start for all of this. And then I think too, from a cultural standpoint, there are many social barriers, right? So whether you have access to care or whether you have insurance, and then sometimes even people that are insured that look like us, because of mistrust of health institutions, how they've previously been treated at appointments, those also can be barriers to us actually taking care of ourselves.
Excellent. And now I'm actually going to pop up a question or two, but I want to finish this one, which we have heard part of my typing. So you just mentioned, so I just put up certain things that like key things, right? Know your numbers, of course, which a lot of times people just say, oh, I'm good. And then they don't check. And so, yes, I do know personally, people who've walked around with like a blood pressure of like 200 and they're just like, oh, I feel okay. Go in for something random. And they're like, hello, guess what? You're not leaving. We're keeping you.
Mm-hmm. I mean,
right?
because it's stroke level. And I even hear people say, oh, I went to the dentist and they checked my blood pressure. So kudos to dentists that are now checking that, identifying, and, having people follow up.
That's great. So listen, next time you go to the dentist, everyone ask them, do they and can they?
Mm-hmm.
Okay, excellent. So the other one is whenever you see a health table, stop by, check your numbers, right? And then the last one I just put up is misinformation and disinformation. Yes, as a community, sometimes we do still feel slighted by those who
were done wrong. Tuskegee experiment, which, that was in my grandmother's lifetime. So it's not like we're so far removed from these things that have happened to us.
And Henrietta Lacks.
Yes.
That's another one. So let's sort of talk a few numbers. I'm actually just going to say, Clan Lewis, thank you. Wonderful. Thank you. Sister Elizabeth. I see you, Sister Elizabeth, with the camera. Excellent. And my number one fan. Hey, Mom. I know you're here.
Hi, Mom.
All right. So now we're going to get into a little teaching. So thank you so much for the people who have popped on. There's like more than 32 because that's only on YouTube. So I think there's other people on Facebook. Thank you so much, everyone who is popping in. And if you have questions, again, because now it's time to learn. Like now it's time to get into some actual numbers. So Dr. Sharmaine has actually put together a little side presentation that we're going to take a look at today. And let me just put this aside and let's get going. So do you want to give a little precursor to what we're going to look at right now?
Yes. So what we're going to do is just really talk about why it's important for us as African Americans to really just be on top of our health. And then knowing your numbers, because what we're seeing with a lot of African American females in pregnancy, these adverse outcomes where they are losing their lives, and some of it could be prevented. A lot of times what I'm seeing in the workplace is for the females that have high blood pressure during their pregnancy, sometimes it will resolve in that postpartum period. But then for those where it doesn't resolve, a lot of times they've had undiagnosed high blood pressure. So basically you've gone to an appointment because of your age or whatever, your provider dismisses it and they don't really feel like it's something where they need to start medication or actually have you manage it. So just looking at our numbers in the United States in totality, as we even look at like other industrialized nations, as well as what they consider under industrialized nations. Oh, you're muted.
Thank you. It's because I'm typing as well. The reason why we added this component this time is as whether you are a local missionary and you're serving your local community, so 25, 30, 50 miles from your church center, or your church has a health ministry, and there are people who might be connected to the health industry to service your church. And when we go out to do mission work across the country, let's say if there's a disaster that's occurring, let's say when we've serviced like Louisiana, when we've serviced Texas, or where we've had the storms, there are people who need a variety of health of health information or of health necessities or medical products, medical personnel. And sometimes we may be thinking, oh, let me send toothpaste, where really, if it's someone in this particular situation who is in their maternal stage of life, they may need slightly other things, or certain things that we may need to be mindful of. The other thing is, again, when we go across the seas and we're thinking, yes, I'm just going to bring like some clothes and some books. Some of the things pertaining to health needs, if we have this information, the lens that we are using can shift in a way that better serves the needs of the people. So now we're going to move to our presentation. All right, so tell us what we got.
All right, so this first slide is data from 2020. And when statistics are reported, usually there is a few years lag time in information. But this came from the CDC. In 2020, the US maternal mortality rate was 23.8 deaths per 100,000 live births. So when you look at the other industrialized nations, even with France being second behind us, we still are 3 times higher than France in our mortality rate. And when we think about the causes, so this can be severe preeclampsia, which can be in organ damage where you have kidney, liver damage, postpartum hemorrhage that a lot of times you hear about, women that have C-sections, so different things like that factor into that. Then this second slide, Black women face 3 times the maternal mortality risk of white women. So even when we look at the comparison between Black women to white women, it's about 19 to every 100,000 birth. And then even Hispanic women, 18 to every 100,000 births. Now, what I found interesting when we look at the infographic to the right, maternal and child mortality in least developed countries. So in 2000, there was 1 in 27 maternal deaths. In 2020, there was 1 in 66. So as we always have these preconceived notions of what other countries are doing, especially when we think about our African countries, even Caribbean places, sometimes with all of the resources that we have in the United States, people fare better in other countries, which really, that's what we really have to get to the crux of, right? Why do these disparities exist in the United States the way that they do? A lot of them for African Americans is related to systemic racism, social determinants of health. So where you live, where you grow up, education level, as I always say, access to care, whether you're uninsured, underinsured, and then even if you have insurance, but you just don't trust the healthcare system. And then this is why my job is really important right now. So the American Heart Association, they came out with a statement of how to treat women with high blood pressure disorders of pregnancy. For a long time, the guideline was don't treat until the blood pressure was 160/90, which by that time, a lot of things have already started to happen. So you'll have the protein that's spilling in the urine. So now the classification for it is down to 130/80. A lot of the patients that I see, they're referred from their OBs. So if they're going into the office and they have a blood pressure that's 135/86, they will make the referral for us to see them. But even things that we can do, I always recommend that even if you don't have a diagnosis of high blood pressure, it is a good thing to have an automated blood pressure cuff in your home. Even if you're in Walmart or pharmacy and you see the blood pressure cuffs, check it, see what your numbers are. And then when we talk about next steps locally and internationally, so as already stated, health literacy is really at the crux of where everything begins, right? So just having more awareness of how high blood pressure affects the African American community, the role that it plays on women during their pregnancy, is really where we can start. For us at Mount Olive with the health ministry, on the 2nd and 4th Sundays after service, we do offer blood pressure checks. And I think that's one of the things that we can start looking at too. Churches that have health ministries, what can you do within the church as far as the education around high blood pressure, screenings, what type of community outreach can you do? This past February, we actually had a self-care expo at our church. And it was really well attended with our community. About 100 members attended. We had 15 vendors. And when I was planning this is when the Global Missions Hack came on, because it made me think about when I went to Ghana and I was told that for the school-age children that we screened, if they hadn't come to school that day, they probably would not see any clinicians until the next missionary team came. So whether that was 6 months from then or a year from then. So I really tried to, in planning purposes, abroad and locally, just look at how can you make an event comprehensive, right? So in this event that we had for the community, we had vendors from our health department, our federally qualified health centers. So if someone was screened, say, for example, for high blood pressure that day, they had an elevated blood pressure reading, but they didn't have a medical home. So when I say medical home, you don't have a primary care provider that you see. Then we had people on site that had health services that they could be referred to. We had clinicians from the Heart Institute where I work, our women's division. We had a urologist there to talk about prostate health. We had a dermatologist to talk about skin cancer and just all these abnormal moles and different things. And I think that is really where we start on the local home front, right? Like with the church just being the backbone in our community, like being able to offer these services in an environment where people feel safe, they trust their community partners, they trust their church members. I think that is really where it starts. And it doesn't have to be elaborate, right? Because what we're talking about is something very basic as blood pressures, knowing, and then two, just the education around it, being able to provide educational information from the American Heart Association, American Diabetes Association, where people can really just sit and kind of marinate with what are those numbers. And, you know, medication is not always an absolute. If people can do lifestyle modifications, diet, exercise, and just knowing what your numbers are, then that's also a solution too. But I also feel like if you know the blood pressure is elevated, you have to actively do something, because ultimately we do want to prevent any adverse outcomes. So whether that's heart attacks, strokes, anything debilitating like that. Okay, so you can take the slide down. So thank you for allowing me to share that. I feel like right now I'm really in this season of, this is like my baby. So like, this is my hypertension project and just the awareness. And when we think about like, we're in a new year, right? Investment me, what could we do to help our health? Purchase a blood pressure cuff. On Amazon, you can get a decent blood pressure cuff anywhere from $25 to $30. So that could be just not going to Starbucks for a week. You know, just a little thing. And that's where you start. That's where you start. And even when we talk about like diet looks different for us compared to our Caucasian counterparts. So still enjoying the things that we grew up eating, but finding a way to make them healthier. And then exercise. There's always going to be barriers to exercise in Black women. We don't want to sweat. We don't want to mess our hair up, all those things. But I mean, walking, Pilates. And then as we're on YouTube tonight, there are so many videos on YouTube, fitness videos that you can do. So you don't have to go out and get a expensive gym membership. It's just, you know, little things that we can do with the resources that are right, you know, at our fingertips.
I want to thank you for pointing that out. I'm actually going to pop this back up. So I asked the question, does your church have a health ministry? If it does, and again, it could be as simple as there's somebody maybe once a month or a couple of times a year doing like just the blood pressure, you know, checks. So I had to shout my church out, Salem Missionary Baptist Church, Brooklyn, New York. Ours is called the Life Enrichment Center.
Yeah.
And so we started out a number of years ago just doing that, but also having like just, we have social workers on deck, and most of our churches do have people within the health and related health service industries. And so if you do not, yeah, you could talk to Dr. Sharmaine right there, right there. And she can provide some guidance. Talk to some of your other churches that are in your area. I'm sure every town, major city at least, has a health department. There are plenty of people from the health department who are looking for opportunities and ways to bring this information out. Now, again, some people may say, well, how does this connect to global missions? Because once we get ourselves, quote unquote, better here, and this is very key, and those people who lead mission trips, they usually say, please don't go over wherever there is thinking that you have it all together.
Mm-hmm.
Because the slide presentation, I'm actually going to pull it back up just for a moment. This one. So
Mm-hmm.
this slide talks about industrialized nations, and let's just call them out. This is France, Canada, the UK, Australia, Switzerland, Sweden, Germany, Netherlands, Norway, New Zealand. Don't like, I haven't like slipped on a bar of soap and hit my head. None of these countries, oh, excuse me, no, I think we do have a place in the UK, I believe, that we service, somewhere in the UK we service. But these are not countries that we actually provide our mission work to in great numbers.
Right.
But these are the industrialized nations. But then the other slide where you talked, wait, let me bring it back because, hold on. So is it this one? No, this one.
Mm-hmm.
Where, right, you were talking the one in the blue where you said in 2020, and then you gave a number 1 in 64. So the point I believe you were trying to make is that we think that we're industrialized and we think that we got it all together, but there are other countries that have a greater number of people of African ancestry. I'm gonna keep it simple.
Mm-hmm.
But the mortality rate, even though it is projected in the media as it is a greater percentage number, is actually the opposite.
Mm-hmm.
But we don't get that information. So we tend to walk over, fly, swim, what have you, into other places and say, oh, let me tell you how to make it better. And there, if, those people who over wherever there is, they look at their numbers and they're like, from the US, like, did you check your numbers? Right. So I just wanted us to sort of be aware that sometimes the numbers are skewed, and then we tend to think that we are this privileged group, that we have all the answers, when realistically we might be able to look at what the food that is being eaten because it's closer to the ground and it's coming out of the ground, right? So I do actually have another shout out that could not be given through this portal, and it says, so this is someone that bought their own BP tester. But then this person says, so I bought my own BP tester, blood pressure tester, to monitor, high blood pressure, possible high blood pressure. And then the person says, ask her to talk about sodium intake. Sodium intake. So you talked about diabetes, you talked about high blood pressure. Talk a moment about sodium intake, and then we're going to shift. And if there's any questions, we're going to do that. And then we also have something to share. So this year, we're going to be doing little giveaways. Little digital giveaways. So get ready for your giveaway for today. Okay, go Dr. Sharmaine.
Okay, so sodium intake, and that's another one of those things too. It's our diet, right? If you consume the American diet and you patronize fast food, even if you go to restaurants, like the salt content in the food that is served it's so much more than what we should consume. So if you don't have high blood pressure, you should consume about 2,000 milligrams of sodium a day.
Wait. How much is that in a teaspoon? Because
So it's probably not even like 2 to 3 tablespoons of salt a day, right? But think about it. If you go to Chick-fil-A, if you go any fast food place, a lot of times they already have 1,000 milligrams and like just the sandwich that you consume.
But we have to have a sandwich and fries.
And fries, right? So then that's what I'm saying. You've blown the 2,000 out of the park, and you've only had one of your 3 meals for the day. So
Wait a minute, no Lowry's, no Lowry's, no adobo for my,
so
Caribbean and Spanish family. No adobo, no seasoning.
light other herbs and
Come on.
spices. So using garlic, ginger, what is
Shout out
it,
to
Mrs.
the
Dash. So it's just, and that's the thing. Like, we just have to think about how we prepare things, because even going into New Year's, I'm sure there were black eyed peas, there were collard greens,
of course,
cornbread, all the things that we eat, to have a prosperous new year. But then you have to think too, how was it prepared, right? Because what kind of meat products did we put in there?
come on,
Right?
folks. Y'all can shout out who put the ham hock. And if y'all still do the ham hock,
I'm from Mississippi, so a ham hock, a neck bone.
Come on, shout out in the comments. We can do that. It's okay. No shit. Listen, we listen and we don't judge.
But I have to tell you, even for Thanksgiving, and my aunt, she is gonna kill me. But I looked in the pot and I was like, "Ooh, it's no meat in these greens." I was like, "Ooh." I was like, okay, she understood the assignment, right? Understood. So as I'm saying, what we have to do, even when I look in the pot, I'm like, oh, okay, this is the new move that we're making. But it's the process, and it's a journey. And I say, with everything, we have to give ourselves grace, right? Because it is one of those things that in our culture, or at least for me being from the South, from Mississippi, like, food is love. Like, if they know that we're coming from Virginia, everybody's going to cook something, all the things, but it's in moderation. It's in moderation. And then actually, like, knowing the numbers. Like, for me, I do take blood pressure medications. And I was one of those ones where, like, even my provider kept saying, oh, well, maybe you're just stressed, you're just this. And I'm like, no, this number is consistently high. And I was like, I want to go ahead and start something. And I'm like, if I lose weight and things change, then great. But I don't want to be in a situation where we knew it was elevated, and then I have the risk of impairing my kidney function, because being on dialysis 3 times a week is not something, that I want to endure. And like I said, hypertension is definitely preventable. I know a lot of people are reluctant to take medications. And then sometimes, even with hypertension, what people have to realize is, for you to be at goal, it may take more than one medication for you to reach that. So that's not necessarily a failure, but it's also still, if you're still eating the things that you were eating when you got diagnosed with high blood pressure, one pill is working so hard to try to regulate things that's why additional pills are needed. And then even and the ladies that I treat, we see that over time, once they do the things, they start exercising, they change their diet, their blood pressure lowers, medication is eventually reduced. Sometimes it's even discontinued where they no longer need it. So it is one of those things where just staying on top of it, knowing your numbers, knowing how you feel. For example, with me, when I have a meal that has like a high salt content, I actually get a headache. And so if I check my blood pressure, usually it's in the 130s, 140s range. So, I'm glad that I have that internal check now, where I know, for me, the headache is most likely my blood pressure is elevated.
Okay, I'm actually just typing something.
Oh my goodness. What did my dad say?
Oh, wait. I know I'm going to put it up. See, I don't know. You can see it, but I don't think everyone else can see it. So hold on a second. So first, I'm actually just going to pop this up. Wait, so someone in my own chat says, when we were talking about things that were in the pot, that someone is, says salt pork. Salt pork, the little fat bag. Okay, let's move on, right? So here we go. So this Sister Kendra Singletary, what are your thoughts on holistic treatment for blood pressure? For example, hibiscus teas. Now, before you say anything else, we are not here to like have any diagnosis. she is the doctor, but this is not what this conversation is about. So of course, check, all of your medical personnel, right? Do your own check, do your own, right? We're not prescribing. So
Not prescribing.
I'm going to leave that at that. But now let's get to sort of the other thing. So, Sharmaine, your dad had a Black Eyed Peas plus. Oh, okay. I guess we know what that is. Yeah, we know what that is. All right. Yolanda Davis McCormick has a pretty good line of no salt blends, different varieties. Anybody from like New Orleans? I started using this Tony Chichairs or something. Nice little salt. Okay, just saying. So here's the very important thing, right? Pay attention to your body. So your body sends you a signal that says, man, I got a headache. Let me check my numbers. Some people be like, oh, I got a headache. Let me just go take a nap. How about, no, your body is trying to tell you something, but do we listen?
Right.
Do we listen? So, and I'm always going to tie this back to what we do at Lott Carey, right? We are an additional information center, the information they would get in. And so I tried to put up the diabetes. Did I put it up? I did. Where is it? ADA.
American Diabetes Association, American Heart Association.
Right, here we go. So diabetes.org. And then I put the other one up for the Heart Association, which is the American Heart Association. So we have that up as well. And then again, once we take this information and we sort of act like, oh, we're going to come alongside, not that we're telling people what to do, but we are supporting them in what they know is best. But when you, Dr. Sharmaine, when you go again across the street, across the city, state, town, across the other counties, and then go across the waters, you become this additional trusted messenger. You become this additional lifeline, literally and figuratively a lifeline to other medical professionals, because, Doctors Without Borders or all of those varieties of things, you get to be in concert with other medical professionals wherever you travel. And then they can pick your brain about certain things that we do here. You pick their brain about what works well. I'm sure when you go, whenever it is that you do this traveling, not just that you're bringing, let's say medical supplies, but you're also bringing information about how, let's say, our best practices, and then the two get to meet and sometimes marry, coagulate, and then, well, that was a nice euphemism, right? And then, right, try to make the blood stronger, right? Coagulation, blood stronger. So once, and this is like a note to everyone, you can monitor, improve, influence, impact your own personal health, because that's what women do, right? We are the nurturers. We are the healthier people sometimes in the family, and sometimes what we put in the pot is going to improve and impact. I'm not going to say the other thing, but improve or shift how we feel. And then as we show up in our churches, how we show up on the mission field locally and globally, we get to make an impact. But what's the impact that we're making, right? What's the impact that we're making? So 2 more comments. Erica Wilson, thank you, Sister Dr. Sharmaine. You nailed it with the healthy literacy tidbit. If we don't understand the information about our health, how can we be involved in shared decision making? Yes.
Yes. So that's one of my classmates. Thank you, Erica. No, and I think that's one of the things too, when we talk about understanding, right? So how do we show up when we go to these appointments? And then do you have a provider where you're discussing all of your treatment options? And I always say it's a difference between someone talking to you and someone talking at you, and I think that's very important. And I think a lot of times in our community, and for whatever reasons, some healthcare providers sometimes can be a little intimidated when we show up with questions. And, I feel like you have a choice, and healthcare providers also. So if you are seeing someone that you feel like may dismiss symptoms that you're having, if you think you should have additional testing and things like that, and you don't really feel like it's shared medical decision-making, then I always say to find another provider. But then also, before you leave that provider, just give them a little feedback, because maybe they're not aware, and as providers, we don't know everything. And I always tell people, You live inside your body 24 hours a day. So like when people come in and they're describing symptoms, like sometimes what we really need to do is just listen before we start trying to prescribe and treat. Just actually listen.
Excellent. So this, I am going to pull this up, but I do feel like this question is going to have to be like a sidebar conversation, and or it should come at probably again in another time during our year. So I'm going to put it up just the same. So this is Sister Kendra. Thank you so much, Sister Kendra. What are your thoughts about premenopausal symptoms, including blood pressure response? Again, I'm putting it up, but I think that should probably be like a sidebar conversation. So Sister Kendra, we have contact information for Dr. Sharmaine, and that's something
And
that
then the only thing I would like to say, because this is another like nugget. So I'm doing the postpartum care, and then we're also doing care for menopause, for women in menopause transition. And I think that is one of the areas where a lot of people are left to just deal with the symptoms. But I think you need to get proper screening, see what your cardiovascular risks are. And then if you are low risk, then it's safe to consider hormone replacement therapy, because menopause lasts for so long for so many women, from anywhere from 5 to 10 years. So why be miserable when there are treatment options out there?
there you go.
Okay.
Beautiful. Here's the comment. Sister Erica Wilson, we need to treat our health like one of our kids, protect our health by being bold enough to speak up when we don't understand. And then Sister Lottie says something as well. Shout out Salem, I see you. Do not be afraid to ask questions. Always be your own advocate. And again, here on Lott Carey Wise, we are advocating not just for ourselves, because we've been at this, supporting this work for how long? 100, and I said 100. 125 years, and we are still growing strong. We are still growing strong, but as we get smarter, we need to be smarter and also more strategic. Brother Roland,
Go ahead.
living witness what Dr. McCoy is saying, so true. Beverly.
And I think too, when we think about advocacy too, it is also allowing your family members, and I know sometimes people don't like other people in their business, especially when it relates to health, but I feel like it is good to take a family member with you to an appointment. If they can't make it to the appointment, just asking the provider, can you call my daughter, my husband, whoever, on FaceTime, put them on the speakerphone, because sometimes depending on the situation you're dealing with, like it can be so heavy for you as a patient that you actually miss key things. You don't have the opportunity to ask questions because you're still stuck on the first thing that they've said, and now they're on the fifth thing. And I also recommend taking notes. Like, you don't have to memorize everything. For me, I like with our electronic health record, we have a wrap-up section. So what I do with the patients that I see, like at the end, I just summarize everything. Like, this is your take home. This is the homework. Like, send me your blood pressure readings, do this, do that. And then just making sure that everything is reviewed so you know what are your next steps. When's your next appointment? Things like that.
Excellent. And we are almost ready to give out our giveaway. This is going to be a thing in 2025. We're going to have giveaways, so you all have to show up. So thank you, Sister Hazel. I love all this information. What outcomes have you seen with preventative measures? Oh, and our former past president, Dr. Angela Clifton, says, excellent session. Thank you, Dr. Sharmaine. She can't be seen here, but I see her in another place. And then, thank you for all the information. So with preventative measures, so let's make like a wrap-up statement about here. And then again, we're always trying to not just talk about what we're doing here, which is crucial, because of course, if we're not good, how are we going to go somewhere else talking about we're going to come in and help you, and we need to help ourselves, right? So we're trying to get ourselves better, and then also bring similar information to come alongside in order to support other communities. And those other communities don't have to be across the water, right? They are across the street. There are people who need support across the street, across town. Our elders, if our elders are away from their let's say younger loved ones who could go to the doctor. We, the church, right? We are the church. We take care of our personal family first, and then we have our extended family in the church. Then we have our community, and then we continue to broaden the scope. So, so let's maybe give a point about this question: outcomes that you've seen with preventative measures. Yes.
So one thing I like to say about that, in the United States, historically, we have not done a great job in prevention. I remember one of my friends from high school, when we both got out into the workforce, I remember her wanting to see a registered dietitian because she was overweight. And our insurance denied it, saying if she had diabetes, if she had high blood pressure, then she could see a dietitian. So I think we are just getting to that really true preventative stage where, with the prevention, what we're trying to do is reduce adverse outcomes. So preventing heart attacks, strokes, and then also reducing risk factors. So making sure that people don't develop diabetes, which increases your risk for having heart disease later in life. Then, of course, the uncontrolled high blood pressure, how that ultimately can lead to kidney failure, then somebody being on dialysis. But I think like the biggest thing, and I'm gonna get on my soapbox again, it all starts with the education. So just the awareness around, these are the things in our community that adversely affect us, lead us to have poor health outcomes, and how can we reduce that, right? So even from a church standpoint, is that having fitness classes within the church. And like for us, we have noonday Bible study. So one thing we had thought about was maybe having chair exercises during that. So I think that's how we change the outcomes within our community, like finessing little activities, little tidbits of health into when we get together and gather. Like we don't necessarily need to gather and eat, but maybe we gather and do some stretches and okay, we can still eat, but we're going to stretch too.
So I'm going to shout my church out, and this is going to step on some toes because we are a part of a Black Baptist, right, ministry, right? I'm just going to say it. Now, we ended on a funny note, okay? We're ending on a funny note. I need those people, because there are 32 people here. I need for you to drop in the chat, what is the color of the beverage that you have at your eating events? Just drop the color. Just drop the color. Drop the color. Drop the color. I'm waiting. I'm waiting. I need it to roll in the comments. Roll in the comments. I need at least 20. Roll in the comments.
Okay, so can I chime in?
Mm-hmm.
We start with the Mason-Dixon line. So yellow and brown. So we got lemonade and sweet tea.
Okay. So I'm gonna shout mine out. Ours was red. Let me tell you the big argument that came, and I'm gonna say Salem Missionary Baptist Church, Brooklyn, New York, right? Flatbush. For years, and I mean decades and decades and decades, it was red. It was red or it was brown, because it was the sweet tea or it was the red juice, right? We call it the Baptist juice, Baptist Kool-Aid, whatever you want to call it. The biggest thing that occurred is probably like maybe 15 years ago now. Thank you. Shout out to Sister Joyce Smith. She's part of our health ministry. She said, let's add some water to the table. You know the side eye? The side eye that came because we wanted to add a pitcher of water to the table. Then it was, so we're going to add water first, and then we're going to bring out the other beverage. People were like, excuse me, did you forget to, where's the juice? You'll have the water first. Do you know the side eye? Come on now. Come on. Thank you. With people dropping the colors. Okay. Because, we got what? I'm going to put these up. Water, clear. I put up the red, clear. Thanks, Mom. The red.
It really should be water, because all of my like diabetes colleagues that specialize in diabetes education, they will tell you should not drink your calories, which means
in the back, please.
You shouldn't drink your calories, which means it really should be water.
So let's just add water first. If you don't already have water on your table first, it's a very easy thing. Add the water first, then get the other stuff. Because if
And
we
then you can infuse it with lemons, limes, cucumbers.
see, and not just in the summertime, right? So again, 2025, we leveling up, right? Because how are we gonna go across? How are we gonna go across the water and come alongside them? And we got 15 or 20 bottles of little pills. Not saying that you shouldn't take your medicine, but let's get ourselves better first.
Or let me tell on some of the missionaries that pack they soda to take with them. So yes.
But look, so now let's get to the giveaway because we had time now, right? We had time. So I'm gonna drop in the chat. Now I pray you're only gonna be able to see this on YouTube. So if you're watching on any other platform, you're gonna see it on YouTube. But no, here we go. So Dr. Sharmaine and I, we came up with this. It's in the private chat. Here we go. We came up with this. How can we move forward and get the information we've been talking about into kind of like everyone's hands? Not really necessarily everyone's hands, but to an extent. So most people know that like February is Heart Health Month. If you don't know, now you know. But again, it's connected to like Valentine's Day and that kind of thing. So they kind of like, thank God the American Heart Association sort of caught the media wave. So it's Heart Health Month. And then a number of us know, because we wear pink, no matter what your sorority affiliation might be, everybody's going to wear pink in October. Why? Because it is what?
Breast cancer.
Breast Cancer Awareness Month. So I said, hey, Dr. Sharmaine, what do you have in your wheelhouse that can add to our Lott Carey world? Because women will always share. We do not gatekeep. We don't gatekeep. We don't gatekeep. So we have, if you click on this link, which I don't think if I click on it here, it's going to pop up, but it is if anybody clicks on it in YouTube, you can actually download it to your own system, phone, email, what have you, and then you can share it with your church. What it is a list of per month the health like aligned foci. Is that a good way?
So it's monthly awareness.
Right, monthly awareness of like health issues, and so that is our giveaway for this month, for our first month. So stay tuned. 2025, you're going to walk away with some information, not just something to listen to, and please do share it, but also something that you can bring to your own church. Please put it up on the refrigerator and use it. Check in with your doctors, because again, all of these systems of the body, check in with your own, doctors. Print it out and add it to the table in your church. Give it to people in your community. Let your community know that your church is concerned about the health and well-being, not just the spiritual body, but the physical body as well. That's what we have for you at the beginning of our 125-year recognition of women in the service of Lott Carey. I hope that you enjoyed it. Please let us know. Let us know that, if we should have another giveaway during next month, which we probably will. But you got to stay tuned. So any final words, Dr. Sharmaine? Thank you, Dave. Brother Dave Curtis says, got it. Yeah.
This was great. No, this was absolutely fabulous. And I think this is how we change things. I am very big in the health disparities area space. And I think just having these candid conversations where people feel comfortable asking questions and getting the answers, but then also going out and sharing the information with their loved ones. This is really how we impact change.
Excellent. And on that note, oh, good. So thank you. So other people have said, thank you, Koyan Lewis. It's been a great, awesome presentation tonight. Thank you, ladies. You're welcome. We literally enjoy doing this. Thank you, Candy2377. Great information. Fabulous. Thank you, Dr. Brenda. We appreciate you. Thank you for the opportunity. Oh, thank you, Sister Andrea Ross. Because I'm waiting for people to tell me. Each month, Andrea Ross's church, please tell me what church you're a part of, because everyone doesn't know. Each month, third Sundays, we have a health awareness moment. I love it. So prayerfully, that is during pulpit time.
Mm-hmm.
Prayerfully, that is during pulpit time. If that is very
That's
important to you,
awesome.
everybody knows. Fabulous. And if you don't have a health awareness moment or a space, call Dr. Sharmaine. She can give you some ideas. Go to
Yes.
your local CDC, go to your local health department, but get the information out, because the church historically has been the place where we got everything. And now,
And you know, the beautiful thing is in Northern Virginia, I think I make the church circuit. So I am borrowed a lot of times. Bethlehem Baptist in Alexandria, Virginia is like my second home. A lot of times when I'm talking about my church, they're like, no, you belong to Bethlehem. No, it's when they're having something that's health focused, like they call me, we plan it. And I think that's, you know, another thing. Even if you don't have any clinicians in your church, if there's someone in your local area, I'm sure they'd be willing to come across town,
come
help
across the road.
you. Yeah. And that's where it starts.
Excellent, excellent, excellent. Thank you. So good. Other people are getting it as well. Okay. All right. Canaan Baptist Church in DC. Yes, it's done during the announcements. Love it. Love it. Let's get, so listen, I just may be asking later on in the year, hint, hint, hint. How is your health ministry going? So if you are here in January and you see me ask this again, love it, love it, love it. All right, fabulous. So wait, one last one. We'd love to invite a similar conversation in February for the NVBA.
Northern Virginia Baptist Association. I'm a member.
Okay.
And I'll be there.
I'm Brooklyn, so but we have our own version. Thank you very much. All right, folks. Thank you so much for staying. Like, it is post an hour and we're still here. I love it. I love it. I
I
love it.
love this too. Good energy.
Excellent. Good energy. Okay, I'm sorry. So thank you so much. Listen, stay tuned, please. If you're not a part, but I believe most people here are actually a part of the Lott, Carey, Wise, Salt, please invite some other people. We really want to spread this information and literally spread the love so that we can stay here, stay well, and then go help people on the other side of the tracks, whatever tracks you call them. This has been a Lott, Carey, Wise, Salt digital couch conversation. Welcome to 2025. We appreciate all of you. We are so blessed to have you, and we thank you. Please meet us back here the first Thursday of February. That means you're also going to be here on the first day of February for the February prayer call, and then look forward to what? To getting on to the 31 days of prayer in March.
Yay.
We have a lot going on. Please stay tuned. Again, the Gmail is lottcarrywise1@gmail.com. If you want to participate, if you want to volunteer, if you want to even add suggestions on what we will do on the digital couch. But we need you. Why? Because we're trying to get across there, wherever there is. We can't do it without you. Peace and blessings. Have a wonderful day, and we will see you on during the next conversation. Have a good night.
Good night.
Sharmaine.